I'm Fei Sim. I'm the National President of the Pharmaceutical Society of Australia, or the PSA. And the PSA is a government-recognised peak body representing all 39,000 pharmacists across Australia, practising across all areas of practice. So we've got pharmacists practising in community pharmacy, in hospital, in residential aged care facilities, in general practice, in Aboriginal health services, in industry, academia, and the list goes on. PSA has had significant input into the unleashing the full potential of our health workforce, or the scope of practice review, which has been a 12-month journey. So PSA's involvement had been what I would call a multifaceted effort. First of all, myself, I'm the representative on the scope of practice review expert advisory committee, chaired by Professor Mark Cormack, who is the independent lead for this review. So through that channel, we've had regular and in-depth input into this process, and I was there representing the PSA, but more importantly representing the pharmacy profession. And on top of that, as the peak body representing pharmacists, we have had regular meetings with Professor Mark Cormack and Professor Lisa Neeson, who's the academic lead on this project, and KPMG as well, who is the contractor working on this project, to work through some of those details. And of course, on top of that, we have continued to gain feedback from our members of our profession to help form our views, and that has been translated into written submissions and otherwise to help form this review. The scope of practice review, I would say, is probably what I would describe as a once-in-a-career lifetime reform that we're seeing and observing. And what we're seeing from this scope of practice review at the moment is very significant, because overall in its totality, it is calling for a major health reform and calling for a change, a real change in health system administration. In other words, how we administer healthcare, in particular primary healthcare in Australia. So in this report, you would see there are 18 key recommendations, and all of those 18 key recommendations have relevance to the pharmacy profession. The intent of the scope of practice review is to identify where the barriers are and what needs to be done in order to remove the impediments to allow all health professionals, including pharmacists, to practice to our full and top of scope. Because we're recognizing that we have an aging population in Australia that will come with increased healthcare needs, and there is recognition in this scope of practice review as well that primary care, to do well in primary care, we need a multidisciplinary team approach that includes pharmacists. So in this report, it is specifically calling out that pharmacist is one of the key providers of primary care and plays a significant role when it comes to improving Australians' access to healthcare and improving qualities of medicines and medicine safety by removing the barriers, whether it's legal barriers or funding barriers or workforce barriers, to enable the pharmacist workforce to meet the health system needs and patient needs. And that exactly aligns with what we have been calling for and what we have released in this Pharmacist in 2030 report, which is a PSA visionary roadmap for the next 6 years into 2030 on how pharmacist potential can be fully utilised to serve health system needs. So the Pharmacist in 2030 was launched in August this year, and it was endorsed by our current Health Minister, the Honourable Mark Butler, and also received bilateral support as well from the coalition. Essentially, this gives the roadmap into what pharmacists can contribute into the future, into 2030, in terms of helping Australians improve access to care, plus at the same time maintaining and improving qualities of medicine and medicine safety, and to do it in an equitable manner where people who live in Australia, regardless of your postcode, regardless of where you live, you will be able to benefit from the capability and the capacity of the pharmacist workforce. And if you look at the 3 key themes in our scope of practice review that has been recently released, it exactly aligns 100%. So in fact, the Pharmacist in 2030 2030 document, which is a document that PSA has released following broad stakeholder consultation, has really informed PSA's view and PSA's approach in this scope of practice review consultation process. And I'm so thrilled to see that the scope of practice report really is aligning 100% with what we are calling in this Pharmacist in 2030. And I'll give some key examples, if I may. Pharmacist scope is rapidly evolving at the moment. However, as your listeners would know, pharmacist core skills is in medicines. So pharmacists are medicine experts, and because of our accessibility in the public in primary care, we're often the first port of call for primary healthcare services and needs of Australians. However, what we do and how medicines and products and therapeutic products are governed in Australia, we're living in a federated model country, pharmacist scope in terms of what we can do is very much bound by state and territory legislation, despite the fact that we do have Commonwealth level or federal government level initiatives and health policies. In Australia at the moment, we do not yet have national harmonisation in the scope of practice for pharmacists. So what I mean by that is you can see in different parts of Australia, for example, many of these innovative projects are started in Queensland, in New South Wales, in Western Australia. They're happening in an ad hoc manner initially, basically to respond to real on-the-ground needs by patient. So I'll use urinary tract infection management as an example, or even the resupply of oral contraception for women as an example. Now, there have been expanding and evolving scope of practice of pharmacists to enable pharmacists to be able to provide better and more timely care to people who are in need of these primary healthcare services. But it's important to recognize that these resulted in real local needs from patients because they're not able to access timely and affordable healthcare otherwise. And you can see how the reason why we have different scope in the different states and territories is because we don't have national harmonisation. But in this scope of practice review, one of the key recommendations of these 18 recommendations is to call for national harmonisation in Medicines and Poisons Act and regulations, which will have a direct impact on what we do as pharmacists and how we can provide more equitable care across the country. So there are no confusion for patients. Regardless of where you live, regardless of which state and territory you live, you can have consistent expectation of what you can get from your pharmacist. And I think that's a key element when it comes to giving confidence to Australians about what kind of healthcare they can receive. So that's one of the key things that I wanted to point out. Also, if I use immunisation as an example, we currently have a program called the National Immunisation Program, Vaccination in Pharmacy program, which is the NIP VIP. Now, under the NIP VIP, appropriately trained pharmacists across the country can provide and administer vaccinations under the National Immunisation Program. However, there are restrictions when it comes to regulation on top of this that restricts pharmacist ability to vaccinate certain age group and against certain types of vaccinations. And also, there is inconsistent funding and remuneration for pharmacists providing these services. So if I put myself from a patient's lens, if I need a vaccination, at the moment, if I access healthcare from another healthcare professional versus seeing a pharmacist, I might end up having to pay different out-of-pocket amount. And this, to us, is inequity when it comes to healthcare access. And in this scope of practice review, it is calling for a patient-centered, consistent and equitable way of funding and remuneration policy that is flexible but also fit for purpose to meet the local needs and demands of people living in Australia. We strongly call on the government to take actions and implement as soon as possible all of these 18 recommendations from the scope of practice review. As I mentioned previously in the PSA's Pharmacist in 2030 report, we specifically called out 6 actions that needs to happen in order for the full potential of pharmacists to be realised to better serve the needs of Australians in terms of healthcare. I've talked about medicine safety and medicine stewardship and improving access to care, but we are also calling the other 3 actions, which relates to workforce investment and development, sustainability, and also equity when it comes to healthcare access. And all 18 of these recommendations in the scope of practice review addresses, if they are implemented in a timely manner, would do greatly when it comes to allowing Australians to be able to leverage and capitalise from the capability and capacity of pharmacists in this space. So we do very strongly urge the government, now that the report is available, we strongly urge the government to make the investment and the commitment into timely implementation of these 18 recommendations in the scope of practice review. Once these 18 recommendations in the scope of practice review are implemented, we're very confident from our profession's perspective that we will be able to remove the unnecessary red tapes that restricts the scope of pharmacists when it comes to healthcare delivery and provision. We're very confident that it would achieve greater level of unity and consistency and equity in terms of healthcare access. We are able to then remove the inconsistency in regulation, but also at the same time make pharmacy as a profession much more attractive and sustainable as a profession, and that would also address the issue around workforce in terms of people leaving the profession and so on, because this will really give the career satisfaction back to the profession for us to be able to attract and retain talent in the workforce in order to continue to service the needs of Australians. So absolutely strongly urging the government to consider implementation of these 18 recommendations, and as the peak body representing pharmacists across the country and the release of a very clear roadmap of PSA's pharmacists in 2030, PSA stands absolutely ready to work with the government, to work with the department and all other stakeholders, including other disciplines, to work together collaboratively in a very constructive environment to realise the benefit of these 18 recommendations. From the PSA's perspective, we're absolutely seeing that there is no way we're going to be able to do this and realise all of these benefits on our own. It really requires a multifaceted effort, all the way from government, policy decision makers to the department, who are, very important workhorses when it comes to health system administration, all the way to all other disciplines, because we can only achieve success if we do this from a multidisciplinary approach, because ultimately it's about patient care. Patient is at the center of our attention. Patient needs and should be able to demand seamless care between the healthcare professionals. So we all need to work together. So I think the next 12 to 24 months would be a very interesting time, but I also think that this reform is going to really, really address health system sustainability into the future as we continue to prepare for an aging population.